What happens when a president tells pregnant women don't take Tylenol? Tonight, we untangle that clash. Maya warns who bears the risk and community harms. Leo presses the forensic science, and I'll walk through what this means for families, clinicians, and policy right now. Tonight, the White House says acetaminophen may be tied to autism, while the FDA says the science is mixed, and the president said plainly, don't take Tylenol. That collision, politics, policy, and personal health, is where we begin.
When a president tells pregnant women to tough it out, that is not guidance. It is a risk. Pain and fever in pregnancy are not abstract. They carry harms. Messaging like this lands hardest on those with the fewest options.
Or it lands as honesty. He said the quiet part out loud. Parents have been trading worries for years. Media folks mocked them, then ran the clips when it got clicks. Let's not pretend the concern appeared yesterday.
Fact pattern. Late September, the President, HHS Secretary Robert F. Kennedy Jr., and FDA officials announced a push to flag a possible acetaminophen autism association and to make leucovorin more available for some autism symptoms. The FDA said studies describe an association, but no causal link is established, and contrary studies exist. It plans a label change, noting a possible association, and reiterated lowest effective dose, shortest time in pregnancy.
Meanwhile, the president told women, don't take Tylenol, fight like hell not to take it, and admitted, this is based on what I feel. That is not cautious alignment with the FDA, that is freelancing with people's health.
He also said there are cases where you might need it. The part the media looped was the most dramatic line. And yes, he jabbed at vaccine schedules. Separate doses, slower timing, based on his instinct. That's the headline bait.
On vaccines, major medical groups pushed back fast. The American Academy of Family Physicians reminded everyone, vaccines do not cause autism. That position rests on decades of research.
And OB leaders called the HHS messaging irresponsible. Dr. Stephen Fleischman said the announcement simplified complex neurologic causes. That matters when pregnant patients hear a command to endure pain.
Yet, HHS did say lowest effective dose, shortest time, and reserved for high fever. That is pretty standard. The gap is tone. Officials hedged, the president didn't. That's a messaging mismatch, not a medical decree.
Public discourse went full throttle. One morning show ran, taking Tylenol is not good. Another host stumbled over acetaminophen's name on air. A calmer explainer told viewers, sit tight, evidence is mixed, causation unproven.
And the manufacturer, Kenvue, warned that scaring patients off acetaminophen could push them toward riskier drugs or untreated fever. Corporate self-interest? Sure, but that specific risk is real in OB wards globally.
Also, real. Parents who feel dismissed. RFK Jr. said many mothers believe vaccines harmed their kids and that they've been gaslit. Maybe scientists should engage those families instead of rolling eyes on cable.
Let's hit the science. Observational studies have suggested small associations between prenatal acetaminophen and later neurodevelopmental diagnoses. A review led by Andrea Baccarelli flagged a possible causal role, but the largest analyses cut the other way. A Swedish study of millions found the link vanished in sibling comparisons, suggesting family and genetic confounding. A large Japanese cohort likewise found no meaningful link.
That is Epidemiology 101. Correlation is not causation. Maternal age, infections, genetics, these overlap with both acetaminophen use and autism risk. You cannot solve that with a podium and a gut feeling.
Hold on. Mixed evidence is still evidence. The Mount Sinai work saw an association. The YouTube explainer pointed to sibling controls erasing it. Fine. That means more study, clearer labels, smarter doctor-patient talks.
Recap 1. The FDA is signaling caution without declaring causation. The president used categorical language. Large studies undercut a simple narrative. That tension drives anxiety in clinics and homes.
And anxiety is not neutral. Pregnant people already navigate unequal care. If a fever spikes at 2 a.m., will they avoid the one over-the-counter drug considered safer because a politician said, tough it out?
This is where personal responsibility matters. Don't take medical advice from a clip or a podcast, ours included. Talk to your OB. The explainer got that right. Do not panic, follow official guidance, check with your doctor.
Leucovorin. The administration touted folinic acid as helpful for some kids, especially those with cerebral folate deficiency. Small trials report improvements in communication or social reciprocity in subsets.
But calling it a breakthrough invites false hope. Autism is heterogeneous. Trials have been small, inconsistent, not fully replicated. Families deserve access and honesty, not a single drug narrative of reversal.
Fair, but don't trash hope either. Leucovorin has a track record in oncology and folate metabolism. If a subset benefits, greenlight physicians to try it, monitor, and publish. That's prudent innovation, not snake oil.
The FDA's position aligns with that. Allow prescribing while acknowledging evidence is preliminary. Autism orgs urge larger, replicated trials before changing standard practice. Those can coexist.
Coexist, if the megaphone is careful. When a morning show declares leucovorin the first FDA-recognized autism therapy, parents hear cure. That is not what the data say, and not what regulators actually said.
Media hype cuts both ways. One outlet sensationalizes danger in Tylenol, another sensationalizes the fix. Clicks all around. Meanwhile, actual clinicians tell patients the boring truth, nuanced, case by case.
And globally consequential. U.S. guidance sets norms far beyond our borders. In many settings, acetaminophen is the only option in pregnancy and labor. A reckless line at a podium can ripple into real harm abroad.
There was also market whiplash. Investors flinched, then calmed when they realized there was no ban and no new smoking gun study. That should tell you, policy signals matter even before the policy exists.
Unanswered questions now. What threshold of evidence warrants a label change? How will guidance weigh the risk of untreated fever against a hypothetical drug effect? And who sets the tone, regulators or the president?
Add, will HHS study maternal infections, poverty, environmental exposures, the systemic drivers that map onto autism risk and medication use? Or will we chase single culprits while inequities do the real damage?
And will scientists seriously test the folate transport hypothesis and other biologic pathways without culture war baggage? If some kids respond to nutrients, find them fast. Put resources there, not into outrage cycles.
Public trust sits on a knife's edge. Several experts warned that language like "tough it out" may stigmatize autistic families and erode confidence in clinicians. Once trust frays, label changes do not repair it.
Trust is earned by telling the whole truth. The Swedish sibling data matters. The Japanese cohort matters. So do small positive trials. Put them in context, not in culture war packaging, and people can decide with care.
Also earned by listening. When RFK Jr. cites mother's experiences, he is saying, stop gaslighting. You can tell someone the evidence without telling them their lived experience is imaginary. That nuance is missing on TV.
The explainer video that trended last night nailed one thing: do not change meds based on headlines. Check with your clinician, watch for the FDA label review, expect more research, and ignore legal ads for now.
And remember the stakes. Untreated high fever is linked to neural tube defects and other harms. Acetaminophen remains the safer over-the-counter fever option in pregnancy. That baseline should anchor this conversation.
Baseline set. Now, demand better science. If the Mount Sinai signal holds, show it in larger, cleaner designs. If sibling and cohort work keep finding no link, say that loudly, louder than the fear clips.
On leucovorin, the smart path is targeted access plus trials. Identify biomarkers like folate receptor autoantibodies, run multi-center studies, and publish nulls and wins. Families need clarity, not slogans.
And support beyond pills, speech therapy, education, caregiver respite, insurance coverage. A supplement cannot fix a system that underfunds services and blames parents when structures fail them.
Plus some media humility. Straight News got some details right, limited evidence, mixed studies, but the Chiron game still nudged panic. Maybe cool it on the definitive verbs until the data is definitive.
Recap 2. Official line: possible association, no causation. Presidential line: do not take it. Science: mixed, with large studies blunting simple claims. Leucovorin: promising for subsets, not a cure.
So protect pregnant people from fear-based swings, publish rigorous guidance, center informed consent, and stop treating complex neurodevelopment as a campaign prop. Lives do not fit into slogans.
And protect parents from being shamed for asking hard questions. You can push back on bad info and still respect the question. That is how you keep them in the clinic instead of in a Facebook rabbit hole.
Next steps we'll watch: the FDA's label language, HHS research priorities, and whether larger trials on folinic acid launch quickly and transparently. We'll also track global guidance shifts following U.S. moves.
And I want to hear from clinicians doing the work, OBs, pediatricians, therapists, about how this messaging is changing patient behavior at the bedside. That is the reality check politicians need.
I want to hear from parents on what would rebuild trust. Less spin, better access to specialists, maybe both. Send the playbook you wish the press and polls would follow.
Our closing thought: when official and public narratives collide, evidence must carry the day. We will be here when the label text drops and when the next study lands. Until then, breathe, ask questions, and stay tuned.